This is a quick video on sterile dressing change to help you prepare for the skill and for testing. So step one, I'm going to verify my physician's order. So I see that Jonah Dinerman has a stage 3 pressure ulcer to his sacrum. So the provider's ordered us to do a wet to dry sterile dressing change to the wound every 12 hours, and it says to use normal saline to pack the wound. So I verified the order, and I'm going to go ahead and get all my supplies ready before I enter the room. So to do this sterile dressing change, you're going to need to bring sterile gloves, an ABD pad. We're going to bring in 3 sterile 4x4s. I'll use 1 to clean, 1 to pack, and 1 to cover the wound. I also want to bring in Q-tips so that I can pack it, and then the 0.9 normal saline solution is what we're going to be using to clean and also to pack it. So making sure that it's not expired in that. I'm also going to need some tape because we'll want to secure our dressing when we're done. So I'll gather all that supplies before I enter the room and we'll start. Okay, so I'm heading into the room now, performing hand hygiene. Hey Jonah, my name's Megan. I'm here to do a dressing change. Before I start, can you please tell me your name and your birthday?
My name is Jonah Dinerman and I was born on 3/18XX.
Okay, and I'm just going to verify that. Wonderful. And do you have any allergies?
No.
Okay. Are you having any pain at all right now?
No.
Okay, wonderful. Your provider is ordered for us to do a dressing change every 12 hours, so I'm going to get that prepared. Okay, does that sound okay?
Yeah.
All right, I'm going to ask you just to lay down, and I'm going to position you so that we can just see the area exposed that we're going to be working with. Now, if this was truly a sacrum wound, I would position her on her side and cover all the areas that I don't need exposed. Okay? All right, so I'm going to go ahead and begin in assessing the old dressing. So I've already done hand hygiene, but I'm going to go ahead and put on clean gloves to assess that wound. And while I'm thinking about it, I've got 2 bracelets on and a watch that I don't want to get into the way of our sterile dressing change. So if you have anything on, take it off at this point. Okay, my watch should be okay. I can cover that with the sterile gloves. So I've washed my hands. And we're going to put on clean gloves and we'll take a look at that dressing. Okay, so here's her sacrum wound. I can see the last nurse did her date, time, and initial. I'll take off the first level, which is the ABD, and that looks clean. So I'm going to go ahead and just toss that right into the garbage. What it was packed with, I do see a moderate amount of serous sanguinis drainage. So I'll remember that because we'll need to document it later. And now I'm going to assess the wound bed itself. So I see some pink tissue, some granulation. It's not approximated. See how the edges are kind of rigid. But I see that it's healing. I don't notice any abnormal smells. I don't see any yellow or purulent drainage, which would suggest infection. So it actually looks like it's healing quite well. Okay, so now I'm going to be ready to go ahead and get started on getting my sterile field ready to clean. So we're going to go ahead and take off those clean gloves and perform hand hygiene one more time. And I'm going to go ahead and start setting up my sterile field. Okay, so like I said, I have an ABD package. Okay, you always want to open your dressings away from you. Okay, and without touching anything on the inside that could contaminate. Like I said, I have the 3 4x4s. So I'm going to open up. You can see on the inside of the package that there's this blue kind of ridge around. You don't want to touch within the blue. Okay, so again, I'm going to open all 3 of these away from me. If for some reason you would contaminate it, it's okay. You would just grab a new one. Okay? It's always cheaper to get extra equipment than it is to give someone an infection. Okay? I'm going to go ahead and open all 3 of those away from me. Okay, and here's our 3rd. Okay? Now I'll have my sterile Q-tips that I can open up so that they're ready to go. Okay? And then I like to prepare my tape ahead of time. So if you want to date, time, and initial a piece of it and just kind of leave it here ready to go for you so that when you're ready to tape, it's all ready. Okay? Now my sterile solution, I'll want to apply before I'm sterile. So check in to say that it's not expired, that it is indeed 0.9. I'm going to go ahead and put a little bit of that solution on 2 of my dressings. I don't want to touch this to anything. You can kind of hover over it and just pour a little bit on there. The first one will be to clean, the second one will be to pack. Okay, and now I'm ready to go. So I'm going to go ahead and apply my sterile gloves, and I'm going to kind of rotate the screen so that you can see what I'm doing. Okay, so we'll use this area right here to apply our sterile gloves, being careful not to mess up our sterile field. Okay, so I wear medium gloves. I'm a size 7, but kind of play with it in lab to see what size you are. Okay, you do have that 1-inch border. We don't want you to touch anywhere inside of that 1-inch border. So I'm gonna go ahead and open this up. Okay, I like to put my dominant hand on first. You can touch the cuff and then slide your hand in, being careful not to touch anything. Some people kind of let this flap or accidentally touch the table, so you don't want to do that. Okay, I've got 2 fingers in the same hole, so that's okay. We'll fix that in a moment. Now you'll go under the cuff of your second glove and get in your other hand. Okay, and now I can go ahead, since I'm sterile, and fix this. There we go. So we've got our sterile gloves on. Okay, and we're ready to go. Okay, so now we're going to get to the part where we're going to actually do the cleaning and changing of the wound. So go ahead, Belle, and I'm going to have you put the wound right up there for me so they can see what we're doing. And we can move that white out of the way. Wonderful. Typically, you don't have your patient participate in this, but she's not positioned. We're okay. All right, so our first step that we're going to do is clean the wound. So I'm going to go ahead and take that first 4x4 that I got wet and kind of clean, typically from the area of least to the most saturated. So I'm going to go ahead and just kind of gently dab it, make sure that it's clean, and then I'm going to throw that away. Okay, next I'm ready to pack the wound. So I'm going to go ahead and take one of my sterile Q-tips and take that other gauze that was moistened with the 0.9, and I'm going to pack the wound, okay, so that it fits in there nicely. Okay, and then I'm going to throw that away, being careful not to touch anything. Now I'm going to take my dry 4x4 and fold it in half and cover that wound. And next I'm going to take my my ABD and cover the entire wound. Like so. Okay? So now it's clean. I can go ahead and tape it and secure it and documenting. Okay, we'll put date, time, and initials on there. And then we'll go back to our patient and reassess. So I can go ahead and dispose of all the stuff that I've used. If you're going to be doing the next one, or another nurse, they can use the same solution as long as it was kept sterile and you date, time, and initialed it. So we can keep this at bedside. And I'm going to go back and just reassess my patient. So Bella, I'm all done with the dressing change. You did wonderful. Are you having any pain at all right now?
No.
Okay, wonderful. Is there anything else I can get for you before I go? Okay, and again, I'm going to make sure that her bed is in the lowest position. Her side rails are up. The bed is locked. Here's your call light. I'm going to document what we did. So we'll document that we did the dressing. We'll document what the old dressing looked like, what the wound bed looked like, and what we did. So that we packed it with sterile saline and that it'll be due to be changed in 12 hours. And that's it.